we're going to talk about the feet. Those of you who suffer from things like plantar fasciitis or bone spurs may experience a lot of pain in the feet. Alternatively, women who wear heels often, or just people who have to stand all day or walk, or runners, will experience some foot pain usually at some time in the day. In this video, I'm going to give you some techniques which you can use at home to help resolve some of that pain. Part of the reason for this pain, if not the main reason, is because, as you can see here in the foot, there's 26 different bones. And what we do all day is we lock up the foot in a solid shoe. So all of those joints and all of those muscles inside of the foot don't get to function properly, which can cause a myriad of things. One of the things that you can do when you get home is to do some soft tissue work on yourself, followed by some exercises to help articulate those areas. One of the ways that I like to do this is with a foam roller. So I like to start in the lower leg, rolling over the calf muscles. You can add more weight by putting the other leg on top. So when you find a place that's particularly sticky, one of the things I like to do is to hold onto there, breathe, and start to flex the foot and dorsiflex until you feel that start to resolve. If that's a little bit too painful for you, you can get one of the many hand rollers available. This one's called a tiger tail. And press it into the back of your leg. There's also a muscle on the front which can get tight on some people that you can press into as well. After that, I usually like to target the foot itself. I like to use the tiger tail. Some people can use a golf ball. For people who have plantar fasciitis, you can use a frozen water bottle. The areas that you're targeting through here is anywhere in the arch, and it's the same process. So as you're rolling, if you find a spot that feels particularly icky, you can stay there, hang out, and breathe. And again, I like to add some movement into this as I'm doing it. Now after you've done all of that, and you've worked out all the soft tissue work, I like to add a little bit of movement into the foot. The muscles in the foot tend to not get worked as much when we wear shoes. So one of the easiest things to do is to prop your leg up, make sure that the knee is not moving, and go through circles. Generally when people do this, they focus on the ankle joint. So I want you to act like each one of your toes has its own brain, and try to, and you may not get as much motion as I'm getting, but try to make big circles with each individual toe. And I want you to do this enough times to where you feel muscles in your foot start to work. And then a few times in the other direction. And that's it.